Well, good afternoon. We are here to update you as we do on a weekly basis regarding COVID-19 here in Nashua and our efforts to combat the virus. First of all, there's some good news on the COVID-19 front, which is that we seem to be making progress in preventing the spread of the virus. Now, there are still new cases, but the biggest positive indicator is that of all the tests that are being run to see if people have the virus or positive for COVID-19, the number of people who actually test positive of the proportion of the entire group that is tested is falling, and that's across the state of New Hampshire. So when the testing began, over 10% of the people being tested came back positive. Now that percentage has gradually gone down, been going down for 37 days now, down to around 6%. Now that shows us that the spread of the virus has slowed down considerably. But I understand that this has been difficult for everyone. The staying home, staying away from our families and friends, limiting our activities in the way that we have has not been easy. Wearing our masks, which definitely helps protect us and others from this disease. Do we really have to do this? You can't. I ask myself every day, do I really need to put this on? But I am determined to do everything that I can do to make sure that we protect our community members, our families, our friends, our people we work with, everyone in Nashua, do everything we can to prevent the spread of the virus. Now, so as we begin to reopen, and I'm going to talk a little bit about that in a couple of minutes, we need to continue to exercise caution because we have done something very important together. We've accomplished saving a lot of lives here in Nashua, keeping a lot of people from getting sick. Again, our friends, our family, our neighbors. And we need to continue to be disciplined. Again, as we open up, we can do more activities, but we need to continue to be careful. And this is particularly directed to our senior citizens because we know that for seniors, the risk, if you contract the disease, of getting a very serious case, even a fatal case, is higher. But even to our young people, if a young child or young adult, middle-aged, whatever, gets this disease, many people don't have symptoms, so they can pass the disease on to a parent, a neighbor, someone who really could succumb to the disease without knowing that they are symptomatic and that they're communicating the disease to someone else. But we are beginning to see the light at the end of the tunnel, and that is very good news. We need to continue to be careful because there could be an emergence. We don't know. The reality is no one knows what's going to happen with this disease. There could be a reemergence as there is more social interaction, as people get together more during this reopening, or there might be an emergence in the fall as weather gets cooler. Some coronaviruses, related viruses, have a cycle like that where they emerge again a second time when the weather changes. So I thought I'd go through a few of the statistics for you. The first slide, just to show you some of the basic facts. But I think what you want is that we rely on science, on these medical experts, on the facts to determine how to proceed, how to go forward, how to reopen. And certainly what you deserve is for us to do everything we can to keep you and our community members safe. Now, looking at our first slide, this just gives you an overview of the global picture of the U.S. So far, over 112,000 people in the U.S. have died, but more relevant to us right here in New Hampshire. There have been 5,100 in some cases. A number of those, unfortunately, people have died. 10% have been hospitalized. And in Hillsborough County, we've seen almost 2,800 cases with 181 deaths. Let's look specifically at Nashua. we've seen 547 cases, positive cases here in Nashua. Now all of these positive patients are being cared for by public health. If they're at home, of course in the hospital, if they are hospitalized, by the hospital staff. But public health not only communicates with those who have been tested positive, but family members, friends, and others who have had contact with anyone who tests positive. And that's the reason for one of these statistics. So out of that 547, most have recovered. There's still 65 active cases right now. And the contacts that public health is working with, the people who've had contact with those 65 people after they got the disease, there are 132 people, 132 contacts that public health is instructing to quarantine and stay away from other people. So if they test positive, they do not communicate the disease to someone else. Now, unfortunately, in Nashua, tragically, we've seen 24 people die, 24 Nashua residents recently, and each one of these fatalities is very tragic. I and others that I know have a friend who died the last few days after spending a couple months in the hospital, and it is a very difficult way for the family to lose a loved one. Visits to someone with COVID-19 are very limited because of the risk of spreading the disease. So each one of these deaths is very tragic. This gentleman's name was Kevin Slattery, but certainly 23 other of our citizens, of our residents, have died, and their families deserve the same condolences, and I extend that to all of the 24 families. Now, in the 86% have recovered here in Nashua, hospitalization rate has been about 10%. So 10% of the people who've gotten the disease end up in the hospital. Now, as we look forward, we're thinking about how to, consistent with the orders that the governor has imposed and is using to try to contain the spread of the virus, we want to gradually reopen so that our businesses can get back to work, people can begin to get back to their jobs. The hit on the economy has been very significant. The number of people in Nashua that it's unemployed exceeds, at one point, over 8,000 people, maybe 10. A lot of people. The unemployment rate in New Hampshire is, at one point, almost 17%. That's come down a bit. But we know that our small businesses are hurting, and of course the people who work for the small businesses many of them have been unemployed for a period of a couple of months. Small business sector is very important to us here in Nashua. Small businesses employ a lot of people, and of course the owners of these businesses live here locally, and they and their families are impacted as well. So we've taken a number of steps to help small business recover, to come back after being closed literally for months. No revenue, no income for that period of time. We have begun, the city has begun, a Nashua COVID Impact Fund. So we've assembled some federal funds from various sources and have assembled $1.1 million. And this money is going to be loaned and, in a few cases, granted to small businesses and some nonprofits to help them get back on their feet. Now, the average loan is going to be about $25,000. We've received so far 55 applications. All of those cannot be granted, but we have a loan committee consisting of some city employees plus also people from the banking sector who are serving as a loan committee and who will evaluate each application and each loan to determine exactly which businesses should be assisted. But most will get assistance. Some of the grants and loans were awarded last week, and they were announced, or at least the recipients, the borrowers were notified. Not all applications have been dealt with yet, but we are making very significant progress in helping small businesses in this way. There will be more loan awards announced later this week. Now, one thing, let's go to the next slide. I thought we'd show you some pictures. One area where we know small businesses are really hurting is in our downtown area. We have restaurants, bars, other businesses that have been closed, people unemployed, and we, of course, want to help them recover as quickly as we can. Right now, the governor's orders prevent any kind of indoor dining at all, but the governor's orders allow outdoor dining. So what we have done, and many people work together to accomplish this, our Economic Development Department, Public Works, you're going to hear from Director Lisa Foto of Public Works in a little bit. But what we've done working together with the downtown business community and the Board of Aldermen, they were instrumental in this as well, is we expanded the outdoor dining area into the parking zone and into one travel lane in each direction, which has greatly multiplied the number of tables that can be offered in an outdoor setting. Tables have to still, because of social distancing, need to be 8 feet apart, but as a result of these steps, the number of people who the restaurants can serve has been multiplied many times. It seems to have been a major success in the sense that the small businesses have been helped very considerably. Many people are back to work, and in addition, the environment downtown has been very positive since this change was made. Now, it has narrowed Main Street to 2 travel lanes, and to be completely upfront with you, we didn't know for sure what the traffic impact of this would be, but we were willing to try this out in order to, as I said, help our small business sector. Now, so far, our observations and we're looking at this very closely, suggest that traffic there's some backups, but nothing horrendous. Some more people are beginning potentially to use the Broad Street Parkway, and the atmosphere downtown, I think, contributes to the experience of driving through downtown as well. So we are optimistic that traffic-wise, this project that we've undertaken, scheduled to be removed on November 15th, we're very optimistic that this will continue to be successful. In the near future, on January 15th, the governor's orders allow some indoor dining, but still very restricted. So we will continue with the outdoor dining in order to help the businesses, and because people seem to very much enjoy eating and being with their family and friends outside. So you see some of the scenes. I'll show you the next. Have we seen the second of these slides already? So these just shows you some of the people who've been enjoying this atmosphere downtown. I get down there all the time, and there are many people who have gotten back to us to say that it was really a positive experience. Another thing that we want to work on, because we want to make sure that our city services continue, and of course our essential services are the same as always. Public Works with picking up garbage and fixing streets, the paving plan of action, as well as police and fire, our first responders, they're all still working. And the vast majority of other city employees are working remotely or going into City Hall under limited circumstances. But one area where we need to serve the public is in the area of motor vehicle registration. So we have modified the system so that you can register your car, new car, or a renewal or a transfer of some kind remotely. You need to contact the vehicle registration office. If it's a renewal, that can be done by mail, but if it's a new vehicle, you need to call or email, and they will set up an appointment to exchange documents, do the necessary work to help you get your car registered. And at least here in Nashua, the PD is aware that the obligation to register was suspended for quite some time. That was a governor's order. So they realize that some people might be late in registering their cars. But if you have an unregistered vehicle, you should contact motor vehicle as soon as you possibly can. Now, in terms of the progress that we are anticipating in terms of reopening, the next slide shows you what some of the state orders are suggesting. Again, on June 15th, their restaurants will be allowed to open indoors at a 50% capacity. Tables will have to be separated by a significant distance, but of course we will still have the outdoor dining in the downtown restaurants, as I've already discussed, and elsewhere in the city. On June 22nd, day camps for our kids will be allowed. This is again the governor's orders. Will be allowed to open with very significant restrictions, limiting the number of kids and the way they get together, so that there's not an outbreak in a camp or in a group of kids. On June 29th, overnight camps will be allowed to open with restrictions. Of course, we have overnight camps not so much in Nashua, but up north in the Lakes region and elsewhere. And if you want to see what the state orders, the governor's orders do require, there's much more detail than I'm providing here. The slide gives you the website where you can go and get all the detailed information. Our efforts to fight the virus will be ongoing, and it's important to test as many people as we possibly can. Tests are much more widely available right now than they were a couple of months ago. Many private medical providers, the Convenient MD and the primary care physicians have tests, the hospitals. So there are many places where you can get tests. Dartmouth Hitchcock, some of the pharmacies. But if you want to get tested and you would like to work with public health, our public health department, they're running testing clinics every Thursday from 3 to 6 p.m. You need to call them to make an appointment. But if you do that, they will make sure you get tested. They can be reached at the COVID-19 hotline, which is at 589-3456. Now, before I turn you over to our next speaker, who's going to be CAMILLE Pattison, she's going to tell you about the reintroduction of the bus system, the transit, that we are undertaking in a gradual way. I wanted to reiterate for you some of the public health recommendations that you should follow to help keep yourself, your family, and your friends, everyone safe. First of all, you need to wash your hands whenever you go out. Wash your hands frequently, that people can pick up the virus in touching surfaces and the like in a public place, and then can take in the virus through breathing and into their lungs. So you want to wash your hands. That kills the virus. Number two, you should wear face coverings, the masks. This is something that helps very effective. Science shows that, the recent research, in containing the spread of the virus, because virus is contained in the very small particles, the mist that is emitted by anyone when they talk or sing, but even talking will result in the virus being spread into the air, and that can be picked up by someone else. Of course, avoid close contact with other people, but particularly large groups of people. Definitely, at least for now, do not get into gatherings of more than 10 people, and try to remain 6 feet distance from others. I know most of you have heard these cautions before, but we want to reiterate them because together they are very effective in helping to contain the spread of the virus. So again, this is something we have been working on together. We've all made very significant sacrifices, but it has been worth it. We've accomplished something very important. So far, only 500 cases in Nashua. It could be much, much more. So far, tragically, 24 deaths, but there could have been a lot more if we didn't come together to keep each other safe. So now I'm going to turn you over to CAMILLE Pattison, who is in charge of the city's, she's going to come up here. We are going to maintain social distancing, but she's in charge of the city transit. She will explain to you the reintroduction of the transit system that we are began this week, this past Monday. So I'm going to give you to Camille.
Hi there. Is that good? Okay. I'm Camille Pattison. I'm the transportation manager for the city of Nashua. And I'm going to talk to you today a little bit about our school lunch delivery program that we've been operating for the past couple months and our return to service. So the school lunch delivery program we have had in place since the school's transition to remote learning. We've been partnering with the United Way, with the Nashua School District, the Boys and Girls Club, and the Nashua Soup Kitchen and Shelter to provide the school lunch delivery. We were originally doing this on 4 routes, Monday, Wednesday, and Friday. And if you want to transition to the next slide, we, as of Monday, just transitioned to the summer schedule. So we took those 4 routes and we've consolidated them into 2 routes, a north route and a south route. Basically, it's between 11 a.m. in the morning and 3 p.m. in the afternoon, and this service will continue through the summer, and we will see what happens with schools going back in the fall with the lunch delivery program. Next one. Okay, thanks. All right, so on Monday, we had a big day. We resumed some of our fixed route service. So at the end of March, we actually terminated, or suspended, I should say, the fixed route service that we had for the city. And in exchange for that, we were offering a citywide on-demand van service. In the past, as things have opened back up, we've been getting a lot of feedback from passengers who are like, when are we going to get this back and running? We need to get to work. We want to get to essential services. But we needed some time to figure out how to do that safely, making sure that our vehicles were safe and we could keep our staff safe as well. So Monday was the big day for this. And so far, it has worked out very well. And you can see up here, there's maps. We have transitioned and we're rolling this out with 4 routes. We found that these 4 routes provide a significant amount of coverage across the city. For those of you who are familiar with Nashua Transit System, you'll recognize the North, the Central, and the South route are actually modified versions of our night service, and then we added a West route. This was new because we didn't really have in the evening a good coverage of the western part of the city, and that helps us achieve it. The hours of service are a little bit reduced. We're ending at 7:15 at night, but an important note here is that the on-demand van service is actually going on until 9 during the week or 8 p.m. at night, and that it is available for people to use after the fixed route service has ended. Next slide. All right, so just to give you an overview, you saw the map there, but it's probably hard to see the detail on the TV. So with the bus route service, when you look at this, the north route is covering French Hill, Amherst Street, and Dartmouth Hitchcock up at exit 8. The central route covers Crown Hill, the Nashua Mall, and the Broad Street area out to the roundabout by the high school. The south route is South Nashua, obviously, Daniel Webster Highway, Northeastern Boulevard. And the west route covers Lake Street, West Hollis Street, Harris Road, and Ledge Street. All right, so we've had a lot of questions on what's going on with safety. So our number 1 priority is maintaining the safety of our employees and our passengers. So this has taken quite a bit of time to get all of this into place. What we are doing, the first picture here, we are sanitizing all of our facilities and our vehicles on a daily basis. This is one of our maintenance folks using a fogger on the bus. The middle image here is how we're addressing safe seating and social distancing on the buses. So we are exercising reduced passenger capacity. We have nice signs on all the seats to indicate which seats you should sit in and which seats you should avoid. We're trying to maintain this as best as possible. Family groups can sit together, but this is the best way to make sure people are safely socially distanced. And the last picture, we've gone through and we've installed hand sanitizer dispensers on all of our vehicles. So on our fixed route buses and our van fleet as well. All right, so if you're down at the transit center or if you are on any of our vehicles, you'll see a significant increase in safety signage. We're trying to educate everyone on what is the best way for us all to stay safe through the duration of the coronavirus. So the first sign you will see is face covering. So we are consistent with the citywide ordinance. we are asking everyone to wear a face covering when they're on the bus. However, we don't want that to be a barrier. So as long as supplies last, we do right now have individually packaged surgical disposable masks on the vehicles. They're located next to the sanitizer dispenser. So if you don't have one, you can get on the bus and grab one and put one on. We are currently, on a temporary basis, asking passengers to enter through the rear door. This is just until we have a more permanent barrier installed at the front of the bus. The barrier provides an extra level of protection between the driver and the passengers boarding. So for now, if you're able to, you go in the rear of the bus. There's a fare box back there. If, however, you need wheelchair assistance or you need the bus to kneel, you can just indicate that to the driver and they will let you board from the front of the vehicle. And the other thing that's really important that we're asking people to do is be cognizant of how you're feeling. If you're going to ride the bus today, ask yourself, are you feeling okay? If you are ill or you have any symptoms that could be COVID related, we do ask you refrain from taking the bus that day so you aren't potentially spreading germs to other people. It's really important. So a couple things we do want to just mention. The on-demand van service that we have throughout the city is available to folks, and if your origin and destination is outside or beyond a quarter mile of the 4 routes. If you're within that, we are asking that you do take advantage of the fixed routes because we do have limited capacity on the vans as we expand the fixed routes going out. We've had a lot of questions on the transit center. The transit center will stay closed until City Hall opens. So when City Hall opens, that's when you will see us transition into that as well. And as going forward, this is a phased process. This is phase 1. We're going to keep an eye on what our ridership is and see where people are going in higher numbers, and that will indicate how we're going to expand service. Whether or not we add on additional vehicles on these existing routes, and then eventually we will transition back to the setup that we had before with our standard daytime service and ultimately look at resuming a nighttime service. That's it. Thank you. And with that, I will turn this over to Lisa Foto.
Good afternoon. My name is Lisa Foto. I serve as Director of Public Works here in our city. Thank you, Mayor, for inviting me to speak about summer programs. Public Works has received many phone calls and emails inquiring about summer activities. We understand how important fields, camps, pools, parks, and playgrounds are to Nashua residents. The decisions impacting these facilities are made by a city team including Public Works, Environmental Health, Emergency Management, and the Mayor's Office. The city team is following the governor's orders, and decisions will continue to be well thought out and based on the needs and the safety of the residents that we serve. There are many things to consider, including what communities to our north and south are doing. For instance, if a neighboring community closes their pools, that could create an increased demand on Nashua's pools. We have started opening parks. We're very excited about this. Our basketball courts are open. We are asking that there only be 4 people per court. The skate park is now open. We're asking that there be a 10 limit and a maximum of 1 hour per person to allow other people to utilize the space. The horseshoe pits are open. Every other pit is open now, and we have opened pickleball courts and tennis courts. The camps listed on this slide will be offered if we receive enough registrations. Camps will have a ratio of 9 campers to 1 counselor, so space is limited. We will be following strict guidelines provided by the state, and these camps can be registered online at the Park and Rec website. We expect to open playgrounds, which is probably our biggest request, with some restrictions on June 15th, again following the governor's guidelines. We are still considering the opening of pools. We're evaluating that month by month. There are many challenges to this, including what our neighboring communities are doing, and also limits on capacity and social distancing concerns. But we are still going to work hard to try to do that if we can safely. Fields will be opening this week with restrictions. We have a maximum of 10 people, again a 9-to-1 ratio, 9 students to 1 counselor. It will be for practice only. We will not be allowing games at this time. and reservations will be required, again, through Park and Rec's website. This can be done. These are not necessarily only Nashua's rules. I want to reiterate that. These are rules that are being provided by the governor and the state and the CDC. We will be modifying and hopefully expanding these programs as we receive additional guidance from the state. Any questions should be sent to us at dpwrequest@nashuanh.gov, and we will certainly be posting updates both on Facebook and on the city's website. Thank you very much for your time, and now I'll turn it back over to the mayor for final comments.
Thank you, Lisa. Well, we've gotten some questions via a streaming service, Facebook, about the mask ordinance. So the city, upon the advice of the City Board of Health, and based upon research showing that masks are very effective facial coverings in preventing the spread of the virus, the city enacted an ordinance requiring that in various public places, people wear a mask. Now, this question specifically comes about a multifamily project, an apartment project where people live and, of course, encounter each other in the common spaces, the hallways, elevators, maybe some of the common rooms. Masks are required pursuant to the city ordinance in those common areas. And again, based upon the science, the point is to prevent the spread of the virus from one person to another. And the question also asks, well, there are people who are not wearing the masks. How is that ordinance enforced? Well, first of all, the police department can respond to a question, an issue regarding masks in a public place. Now, their approach is one that is based on counseling and advising rather than arresting, but that would be an appropriate 911 call. I'm in a public place. The mask ordinance requires that people wear the mask, and that's not happening. I'm not feeling safe. That is an appropriate call. Of course, if you live in an apartment, you might talk with your apartment owners so that they can remind people that they're supposed to wear masks in the public spaces. Now, some people have, of course, objected to the mask ordinance for various reasons. If you have a health condition which would make wearing a mask a problem, asthma or something like that, a health problem, you are not required to wear a mask in public or anywhere else. But again, what we're trying to do here is we know you want us to act based upon the science, based upon the medical evidence, as that medical evidence and science, the medical facts, the science, as research is developed. Number two, you need us to act, us, the community at large, to contain the spread of the virus, to keep you, your family members, your friends, and all of us as safe as we possibly can from contracting a case of COVID-19. But also, we think you deserve as much personal freedom as the safety of the community allows. So the police department is not arresting people or making arrests as a result of taking people to court of not wearing a mask. They will respond, they will counsel strongly that people should wear a mask, and we believe that with that enforcement mechanism, the vast majority of people will comply. So I would suggest if you live in a multifamily residence, that you make a call to the police or call your apartment owner to ensure that masks get worn in those common spaces. Again, it's only in the common areas. In the individual apartments or residences, masks, of course, are not required by the ordinance. So I hope that answers the question of the person who was messaging us during this press conference. Now, I wanted to talk to you about some events that are coming up quickly. This is part of the reopening. The Downtown Farmers Market is going to be opening beginning on June 21. This is on Main Street. It is on Sundays, very successful, as has been for the last number of years. We will be asking people to wear masks in that public space, even though you're outdoors. But it's a wonderful time to get out into the outdoors, buy some fresh produce and other products from some of our local small businesses, farms. So I encourage you to check out the farmers market. I think it's from 10 to 2 on Sundays. If you've not done it before, you should try it out. Secondly, the city has run a Pride Parade for a couple of years now during National Pride Week. We are not going to be holding a parade, but instead we are holding a virtual Pride celebration on June 27th, the last Saturday in June. And of course, this is to prevent a large group from congregating, again, in order to keep people safe. So you can tune in via the internet, watch our virtual Pride event, which will be broadcast on June 27th. Here in Nashua, every person belongs. That's the message of our event. Everyone belongs. We love every citizen, every resident, and this is part of our effort to make that clear to everyone. Finally, we are holding a coffee with the mayor. This is something I do every month. This will be held on July 15th. This is a virtual event, so you'll need to email questions that you may have in advance. I will talk about a few city subjects, a few city issues, then respond to the questions that come in various forms. So I hope that this information session has helped you get up to date, understand what's being done here in Nashua. Again, I want to thank everyone for getting together, for coming together in solidarity to protect as many members of our community as we can. I and everybody just appreciates all the sacrifices that you have made. And as we look forward, we begin to see that gradual reopening can occur. We're going to do this in a gradual way. We're going to have a careful eye on the number of cases and the other facts that are developed by our medical and experts and scientists. But we will be back in a week to provide you another update, and thank you very much for tuning in. Now, there might be one question, a couple of questions. Is the stay-at-home order expiring on June 15th? My understanding is that it probably will. The governor needs to announce that, but it will probably expire. But the emergency order will still be in effect. So there will still be certain restrictions, numerous restrictions on various activities. For example, restaurants can only operate at 50%. Camps, playgrounds can only operate in a certain fashion. Competitive youth sports is limited. So the emergency order will be in effect, but the stay-at-home order will, I understand, be modified or lifted come June 15th. Seniors should still continue to exercise extreme caution, however. Indoor dining at 50% starts on June 15th. That is Monday as well. So our restaurants will be able to open at 50% capacity indoors as well as the outdoor dining. So that will be a help to small business. And again, that's being done gradually to prevent a big outbreak of the COVID-19 virus. So that answers the questions, at least the ones we've received. And again, good afternoon. We'll see you in another week or so.